Hi, everyone, and welcome to the Health Rules podcast. I am the host, Dave Donahue. I am a board certified internal medicine physician, a fellow of the American College of Physicians, and a board certified lifestyle medicine physician. So I am delighted to be here with you, but I can hear what you're saying, or what you're thinking right now. You're thinking, Dave, you doofus, you do realize there's about a billion things I could be doing with my time right now. There's about 10,000 different health related podcasts out there. Why do we need yet another one? And my answer to that is okay, yes, good point. But one thing we're doing differently here is that we're building checklists. Each episode, we are putting together a checklist of the most relevant or vital information that you need to know about to prevent or to reverse a important condition. So each episode, we will interview an expert in their field, someone who knows the science inside and out, and who also has clinical experience, and so who can help us really delve into this world and help us build out that checklist. The checklists that we build are evidence-based, derived from the best science available in the fields of traditional allopathic medicine. Also in the field of healthcare delivery science, which studies how effective is medicine. We also draw from my field of lifestyle medicine, which really focuses on how can we treat the underlying cause of disease and prevent disease from occurring in the first place. And we also draw from what I call sustainability medicine, which holds that the health of the individual and the health of the environment and the health of the planet are all intertwined. So the fruits of each episode are stored on our website, healthrules.org. We will store the checklist. We will store a printable handout that you can print out and take with you to discuss with your doctor, your provider, your mail carrier, your clergy. I mean, whoever you want to talk to about the thing. You could put it up on your mirror in your bathroom to remind yourself that you are the most important person you want to talk to about this information. So really, our goal is to make this checklist be really the list of things that you want to be mindful of. And if you are, and if you don't miss these key steps, you really can achieve the best health possible. So this particular episode is super exciting. We are going to tackle the topic of kidney health. We are going to address how can you save yourself from the fate of chronic kidney disease. Our guest is Dr. Shivam Joshi. He is an amazing guru of kidney health and the science around what are all the ways we can keep those kidneys healthy and prevent dialysis and prevent chronic kidney disease. Dr. Joshi is a board-certified nephrologist, that is to say a kidney doctor, and a clinical assistant professor at the NYU Grossman School of Medicine. He works at Bellevue Hospital in Manhattan with some other very noteworthy lifestyle medicine gurus. He has authored multiple scientific works on the topics of plant-based diets and kidney health, including a recent paper in the American Journal of Kidney Disease called Plant-Based Diets for Kidney Disease, a Guide for Clinicians. So in this episode, it's really all about how can we preserve those kidneys of yours for the lifetime? How can we avoid the fate of dialysis? How can we, more importantly than dialysis, avoid the fate that most people with chronic kidney disease suffer, which is death from other causes, especially heart disease? So we're going to go deep into the science around the kidneys, around what are all the things that science has identified as ways of preserving your kidneys. Spoiler alert, we are going to talk a bit about plant-based diets. It turns out that plant-based diets are the new kid on the block for keeping your kidneys healthy. There's quite a bit of evidence to support that, and we're going to share that. And I also share it in the references section on the healthrules.org webpage devoted to this discussion. And we are going to also delve pretty deep into So some traditional stuff too, which medicines are most effective, which medicines to avoid. So again, we want to pull out all the stops. We want the tools in your toolbox to be as effective as they possibly can at being able to preserve your kidneys. So I have to tell you that some of what we're going to discuss is a little bit controversial. We live in an era where, although there, in my opinion, is a pretty convincing body of science, that some of these dietary approaches and this whole food plant-based diet really can make a difference in kidney health. Most doctors are not preaching that message. Most even kidney doctors, many very well renowned and very learned kidney doctors do not preach this message. And so again, there's some controversy. I think it's a little bit analogous to the time when medical science had identified that smoking was definitely harmful for the lungs, but most doctors still smoked. So it just takes time for the medical field to come around. I could end up eating those words if emerging science goes on to not support the whole food plant-based diet. But right now, I do believe that there's a pretty convincing body of evidence. And I think that at a minimum, it's pretty darn safe to be eating things like fruits and vegetables, especially as long as you monitor your kidney health and make sure that those measures of concern like potassium and phosphorus levels aren't getting unhealthy. So clearly, this is an area where you don't want to take matters into your own health. You really do want to work with your doctor or your provider, but educate them and educate yourself, and be educated by them. Let's all learn as much as we can about how to keep our kidneys healthy. I want to remind you that the fruits of this episode will be stored on our website, healthrules.org. You can go to healthrules.org/podcast and look for the checklist to prevent kidney disease and progression. And there you can find our finalized checklist. You'll find a printable handout that you can take with you to your doctor, or your doctor can print for you. And if you want to give us feedback, you have some alternative ideas, or we totally missed the boat, or you have some personal experience in this matter, would love to hear from you. Please go to healthrules.org/feedback and let us know your thoughts. So with that, let's get started. Dr. Shivam Joshi, welcome to the Health Rules podcast.
Thank you. Thank you for having me. Glad to be here.
I am delighted that we had this conversation. I've been looking forward to this conversation for weeks now. So thank you so much for taking the time to talk with me today.
Oh, no problem. Happy to be here. It's always great to be talking to like-minded folks.
So please tell us about yourself.
Yeah, so my name is Shivam Joshi, and I'm a physician at NYU in Bellevue. I spend most of my time at Bellevue Hospital. I wear multiple hats. I practice as an internist, as a nephrologist, and as a lifestyle medicine physician. And I also advocate for plant-based diets in all three clinics that I work in. And the reason for that is because I'm a big believer in the power of nutrition and lifestyle, and I want to help my patients not only treat the diseases that they have, but also prevent future diseases. I speak uh, frequently on the topic of plant-based diets and kidney disease, which is why I'm here yet again to talk about my favorite topic. And I've written a number of papers on the subject. It's an active interest of mine.
So how did you come to this place? How did you come to this level of knowledge and this area of scientific scholarship?
Yeah, so I combined two things that I was interested in. I combined my personal interest in plant-based diets. I've been an off and on vegetarian for the bulk of my life. And then professionally, I had known for many years that I wanted to be a nephrologist. And when I came to fellowship, I was told that I had to come with a research project or a presentation at the end of fellowship, kind of summing up and researched, and I decided to combine these two areas. And I kind of jumped into it, not knowing how much information there would be out there or if I would be able to pull anything off. And as I was making the PowerPoint over those 2 years and doing my research, I kept finding more and more stuff. And what I thought would be a very short presentation has now grown several years later into 100 plus slides, and now has been broken up into different PowerPoints because there's just so much information on this topic. And there's every day, every week, there's more papers coming out in this very specific area of plant-based diets and kidney disease, which is amazing.
It is amazing because in my experience of dealing with folks who have chronic kidney disease at various stages, I haven't encountered much of that knowledge around the use of a plant-based diet for kidney disease. And I think quite the contrary, many of my patients were sort of counseled in the opposite direction.
Yeah, and that's a familiar refrain that I hear from many people when I talk about this, and that's no surprise because we as a nephrology community have actively counseled our patients to not eat these foods because we think that it's high in phosphorus or potassium and that bad things will happen. So this is really kind of turning everything on its head. It's like going back to square one and really thinking, are we doing this right?
So yeah, I think very soon we're going to jump in and start formulating perhaps, the authoritative checklist on what people should do to preserve their kidney function. But before we get there, could you tell us if there's any kind of way that folks could follow you, either social media or efforts you're working on that the public should be aware of?
Yeah, so there's two things that people should know about. Is I'm most active on Twitter, and you can follow me at SJoshiMD. So that's the letter S and my last name Joshi MD on Twitter, and that's where I post all the studies that I find, anything I'm working on, interest. That's where I'm most active. And for those that are interested in more resources on this topic, I have a website that I try to update and maintain periodically. I don't always update it in real time, but there's a little bit of a delay. But it's at the moment I think the best thing out there in terms of plant-based diets and kidney disease. So you can go to my website afternoonrounds.com. It's a WordPress blog, but the last post is a continuous update on this issue. And I have resources on papers. And if you're interested in finding a physician that practices this, you can go there. There's also information on dietitians if you're a patient. And then there's a few other things, videos and blogs and other stuff that's all linked there.
Afternoonrounds.com.
Exactly.
Super. Thanks for sharing that. So how about we jump in and start crafting this checklist?
All
Um,
right.
yeah, first we're going to have to give it sort of a title, and I guess I was thinking about something along the lines of preventing kidney failure. But what do you suggest?
Yeah, we could say maybe preventing kidney disease,
Hmm.
preventing kidney disease and its progression. We could maybe say that.
Great. All right. And how are we going to do that? So
Yeah.
let me say one thing is I find myself in primary care in this position of talking with a patient about their kidney disease. And usually the conversation goes something like, well, you have stage 3 chronic kidney disease. And I want to kind of move on to the next topic, but they were, wait, stage 3 chronic kidney disease. What happened to stage 1 and 2? And I sort of have to explain where that came from. And then we got to explain, what are we going to do about it? So
Yeah.
so maybe you could explain, like, what is kidney disease? Why does everybody in the world have stage 3 chronic kidney disease? Before we jump into how we're going to fix it.
Yeah. So your kidneys are these organs in your body. And most people have two of them. A handful of people have a combined kidney, or they have one kidney, and that's congenital or something that's happened at birth. But for most part, people have about two kidneys. They're about the size of a fist or a Coke can, and they sit in kind of your flank region on both sides. And the purpose of the kidney is to filter out all of the bad stuff. So every day you eat and drink things, and then your body uses those things for its daily life support and metabolism. And in the process, the byproducts of that metabolism are excreted out in the urine. And the urine is made by the kidney, and the kidney keeps all your electrolytes in balance, keeps your blood pressure in a normal range for the most part, and it does a number of other things. It converts inactive vitamin D to active vitamin D. It helps make blood. So it's a cool little organ. It does a lot. It's like when it's doing its job, people don't notice that it's there, and that's really its purpose is to do everything to not be noticed, and help you do the things that you need to do in your life. The problem is when the kidneys start to deteriorate. So if you could think of the kidney function as being on a scale from 0 to 100, so to speak, you're generally born with 100% kidney function, and as you get older, the kidney function declines. And if you've ever had blood work, you can kind of see what this percentage is in a rough approximation by looking at this thing called the EGFR, which is estimating how much filtration is happening. Some people have numbers above 100, and that's because it's not an actual percentage. But in terms of explaining it to patients, I give it that number.
Mhm.
Um, and there's 5 stages of kidney disease. The first stage is the earliest stage, and then you can progress on to stage 5. And stage 5 is the last stage of kidney disease. And you could enter stage 5 and not be on dialysis, but as you progress through the last stage of kidney disease, you can end up on dialysis or need a transplant. Or some people who have a number of other health problems go on to hospice or palliative care. So stage 5 starts around that EGFR of 15. You can think of it
15.
conceptually as around 15% kidney function.
Right.
And the idea of what we're doing here today is to try to prevent that kidney disease from happening in the first place. And if you have it, to try and prevent progression. The reason being is that dialysis is no fun. I've met many patients on dialysis over the years, and no one really particularly enjoys being on dialysis or going on dialysis. But it is an important life-saving treatment for those who need it, and for those who are fortunate enough, there are kidney transplants. But kidney transplants um, uh, are are not always available. They're in high demand. The demand often exceeds the supply, and it involves a sizable surgery too, and taking of these medications. So, as always, with many things in the healthcare field, preventing a problem is always better than treating it later on.
Absolutely. And I've read that of all those labs we get in our blood work at the doctor's office, the EGFR is perhaps the most indicative of how much longer we have on this planet. So if you look at sodium, potassium, chloride, even lipids, and perhaps even A1C, that those don't give you a sort of an estimation of how much longer you have on this planet, or how much longer are you going to be active and healthy. But the EGFR kind of reflects this to some extent, does it? Do you agree?
Yeah. Uh, people with kidney disease are often afraid of progressing to dialysis, but really the bigger fear for me is the progression to death, because so many people don't even make it to dialysis or kidney failure. They die along the way. There's some estimates that between 10 and 40 times as many people die than make it onto dialysis. And there's no one knows really for sure why. It could be the underlying causes of kidney disease contributing to the death. A lot of people that have kidney disease have diabetes or high blood pressure, and that takes its toll on other parts of the body. But it could also be from the kidney disease itself that the reduction in filtration of some of these toxins or some of these other issues, like changes in the microbiome, can contribute to an increased risk of death. So it's just probably a combination of these things, and then hopefully in the future, time will tell as to why this is the case.
Yeah, what's that statistic that you're far more likely to have a heart attack or die of cardiovascular disease than to die of you know, renal failure or to advance to dialysis for each
Yeah,
person?
yeah, I have it. I have it here actually. Um, Let me go ahead and pull it up. I have it in my slides. Uh, so there is a statistic. Uh, it's not references on it are difficult to find, but I was able to find one reference on it, and of course I had it here and I lost it. Um, so those with kidney disease are 16 to 40 times more likely to die than to progress to kidney failure, and I found that on a NIH website.
16 to 40 times. Got it.
and the risk unfortunately doesn't get any better once you progress to dialysis or kidney failure. The 5-year survival rate for those on dialysis has been abysmal for years, and it's still a paltry 42%.
Wow, 42%.
Yeah.
Got it. Okay, so jumping ahead, what is our checklist? What are we going to do? We're sitting across the room from a patient with stage 3, stage 4, stage 5 chronic kidney disease. What are the steps we should follow to preserve that kidney function, prevent that progression, and help keep this person alive?
Yeah. So if you already have kidney disease, uh, what you want to do, there's a handful of things that you want to do, and they should be pursued concurrently. So if you have kidney disease, you definitely don't want to develop hypertension or diabetes, because uh, diabetes and hypertension are the number one and number two causes of kidney disease and kidney failure, respectively. So if you're in that situation where you have kidney disease for some reason, you don't want to add on diabetes or hypertension, because these things damage the blood vessels of the kidney, and the kidney is a very vascular organ, and that will only add fuel to the fire. If you are one of those people who has kidney disease from diabetes or hypertension, then recommending that you don't get it doesn't really apply. So what we want to say then is to make sure that it's not uncontrolled, that your diabetes and hypertension is not uncontrolled. We know that if you have more uncontrolled high blood pressure or diabetes, this does not work favorably for your kidneys. So you want to take your medications. You want to engage in lifestyle changes that help promote the control of these diseases, and if not, the reversal to the extent possible. We know from studies like the DASH diet, the DASH diet studies, that people can achieve substantial reductions in blood pressure within 4 weeks just by changing the foods that they eat. So by eating a DASH diet that's also low in sodium, you can reduce your blood pressure by close to 21 or 22 points systolic just within 4 weeks. So if you're someone, excuse me, that has high blood pressure and has kidney disease, you definitely don't want to be eating in a way that raises your blood pressure and requires you to be taking more medications. If anything, you want to be eating in a way that reduces the number of medications and reduces your blood pressure. And the same thing goes with with diabetes. Certain foods can raise your blood sugar. Certain foods can worsen insulin resistance. And the foods that are healthy for high pressure are the same foods that are healthy for diabetes and high cholesterol and protecting your heart and also fortunately protecting your kidney. So those are your plant-based foods. These are going to be your fruits, your vegetables, your whole grains, your lentils, legumes, nuts, seeds, all these sorts of things. And by eating those, you also want to minimize the consumption of foods like processed foods, fried foods, added sugars, meat, dairy, cheeses, things like that. Um, uh, and that combination of foods will help with these diseases. So to go back, if you have kidney disease, try and control, try to prevent have developing diabetes, hypertension. If you have diabetes and hypertension, try and get them under control. And then the next point is if you have the ability to get rid of these diseases, then that's also something to work towards. So if you are someone that's gained um, 10 or 20 pounds as of recently, and now you have diabetes and hypertension, and you also have kidney disease, it's not unreasonable or unrealistic to try to lose the weight through diet and exercise. It doesn't mean that everyone will be able to lose all the weight and achieve the perfect body that they may desire, but everyone is capable of losing some weight through diet and exercise, and the extent of that weight loss is unknown. But you won't know how much weight you can lose until you really um, uh, sort of put your pedal to the metal, so to speak, and try these lifestyle changes out for yourself. And some people do very well. I've had interactions with patients, and they come to see me, and I tell them that they have all these health problems, and I tell them that they need to do these things. And the next visit, they've in 3 months they've lost 10 or 20 pounds, and it's just amazing. Uh, uh, so um, uh, uh, so if you have that ability to lose the weight and make these lifestyle changes, you could potentially reverse these diseases like high blood pressure and type 2 diabetes. And then by eliminating those diseases, you kind of eliminate the risk that your kidney disease will progress from these diseases, which makes sense. And we've seen from some interesting studies that people who have reversal of their blood sugar, there was an interesting study that came out almost a decade and a half ago, showing that people who attain normal blood sugars through pancreas transplants were able to reverse their kidney disease after maintaining normal blood sugar levels after 5 or 10 years. So it's important to control that blood sugar and get rid of diabetes if you have that ability.
Hmm.
If you're not able to get rid of diabetes or your high blood pressure, it's important to stay compliant with your medications. It's important to get your blood sugar in that normal, blood pressure and blood sugar in that normal range, and to take medications like uh, ACE inhibitors and ARBs, angiotensin converting enzyme inhibitors, and angiotensin receptor blockers to prevent the progression of kidney disease. And now we have these new medications called SGLT2 inhibitors for diabetes, for patients with kidney disease related diabetes, and perhaps even kidney disease not related to diabetes that can also help. So seeing a nephrologist like myself may also be helpful.
Gotcha. So are you prescribing the SGLT2 inhibitors sort of more broadly as sort of a kidney drug, or is it still exclusively reserved for people with type 2 diabetes?
I've still been just reserving it for those with type 2 diabetes. Um, Even with those who have type 2 diabetes and kidney disease, it has been difficult to get it for patients. And I get a little weary of prescribing it for those without diabetes in regards to the hypoglycemia standpoint. And I think as more literature comes out, we'll see that perhaps it is safe and maybe insurance companies will pay for it and make it more widely available. But for the time being, I've kind of just been reserving it for those with diabetic kidney disease.
Okay. SGLT2. I'll put links to and give some examples. Okay. So here's a question. I've seen some literature that talk about blood pressure drugs. That switching the timing of a blood pressure drug to bedtime uh, in a randomized prospective trial, they found that this actually it was a prospective trial. I'm not sure if it was randomized. It reduced the rate of onset of chronic kidney disease by a dramatic amount, like 75%. Have you seen any of the literature about the timing of blood pressure drugs?
Yeah, I know which study you're talking about. And at the time that it came out, I was also impressed, and I was considering moving all the my dosing to nighttime. But what's interesting on the Twitter space, it allows you to get connected with um, people all over the world who otherwise you may not have met or heard from. And there was questions in regards to the integrity of that data and whether or not those results could be replicated. It almost seemed too good to be true. So that's why that hasn't been broadly adopted.
That's interesting. I think I've seen multiple studies, not necessarily the kidney one. I think I only saw that in one case, but I've seen some other studies. Maybe they're just different rehashes of the same
Yeah,
primary study.
it's the same group.
Okay.
Yeah.
All right. Well, then that explains why we see such unbelievably dramatic effects by taking it at bedtime. But if there's some evidence that taking it at bedtime might be really helpful, all things being equal, you might as well take it something at bedtime, some of those blood pressure drugs at bedtime. What would you think about that?
Yeah, so there is some literature. So apart from the dramatic differences, there is some benefit to we think at having a nocturnal dipping in the observational literature. So your blood pressure normally decreases at nighttime, and people there's this thing that you can wear as a 24-hour blood pressure monitor. And if you look at it in a population, you'll see that blood pressures are higher during the day when people are out doing stuff. And then at nighttime, it kind of goes down as they become more relaxed and go to sleep. And then people who lose this kind of decrease in blood pressure at nighttime tend to have an increased risk of having bad things happen to them. So, in people, we see this, we sometimes prescribe blood pressure medications at night to kind of recreate this physiologic effect that happens. We don't know if our interventions will improve long-term outcomes, but we do that. So if you do have high blood pressure at night, it's not unreasonable to take a blood pressure at bedtime, especially if you're waking up with blood pressures are elevated in the mornings. It may not be unreasonable to kind of divide up your medications.
Okay. So what about when somebody has chronic kidney disease? Obviously, we should identify the cause of it. Would you put that on the list of things? Make sure we've identified the cause, or
Yeah, so not everyone with kidney disease has kidney disease from high blood pressure diabetes. So if you have the ability and your kidney doctor feels that it's necessary, some people may benefit from having a kidney biopsy. There are other causes to kidney disease, including autoimmune diseases like lupus. People can also develop allergic reactions in the kidney from medications, for example. And now we're also seeing, as of recently, COVID in the kidney. So there's a long list of other possibilities that can affect the kidney.
Obviously, you don't want to miss some kind of glomerulonephritis or such.
Right.
Um, but most kidney disease is due to some combination of hypertension or diabetes. That's basically
Right.
three
Right.
quarters of it? Three-quarters of chronic kidney disease is
Right. Exactly.
okay.
I think it may, yeah, three quarters.
Okay. So we got to identify the cause. We want to think about those lifestyle factors that are causing. Is there specific evidence that exercise is specifically beneficial for chronic kidney disease, or do we just infer that it's beneficial because it's good for blood pressure and diabetes?
Uh, I I would have to go back. I think we infer it. There may be some small literature suggesting some direct benefit, but I have not done a deep dive into specifically exercise. A lot of my
Okay.
research has been with diet, but exercise has all these added benefits, helping with blood pressure, stress, insulin resistance, cholesterol.
Okay. Now, is hypercholesterolemia thought to be related to chronic kidney disease?
Uh, there, there are. It is thought that it can contribute to atherosclerosis and reduce blood flow to the kidney. It certainly doesn't help, but hypercholesterolemia isn't a direct cause of kidney disease. For the most part, it's not like the number one or number two cause.
Okay.
But uh, for people with kidney disease, cholesterol-lowering medications like statins have been shown to reduce major adverse cardiac events.
Okay. So that almost merits a separate check item because, um, since cardiovascular disease is overwhelmingly the cause of death among people with chronic kidney disease, some special attention um, to your risk factors is warranted. Would you agree?
Exactly.
Okay. And that would include probably take a statin and perhaps more importantly, eat a diet low in saturated fat and low in excess calories, and that can very much improve your vascular status and your cholesterol level and your inflammation throughout the body.
Exactly.
Okay.
Foods that are high in plants and high in fiber, high in healthy fats and low in your unhealthy fats. We used to say low fat diet, but now it's in the same way as carbs can. There's good and bad carbs. There's also good and bad fats. So now we say to eat the healthy fats, which are going to be your PUFAs and MUFAs, polyunsaturated, monounsaturated fats, and then avoid your saturated and your trans fats.
Okay. Are there specific foods that you think are helpful for kidney disease?
Specific foods, you know, um, it's not like urinary tract infections where they say to drink or eat cranberries. Specific for kidney disease, there isn't one specific food that has been shown to have magical properties. But what I will say is that for people who have this may get into for people who have kidney disease already. How else can you prevent progression of your kidney disease? Um, Eating fruits and vegetables has been shown to be beneficial in the context of metabolic acidosis. So, in the literature, it has been shown in several studies that metabolic acidosis, which is this complication of kidney disease, can promote the progression of kidney disease. And if you treat the metabolic acidosis, you can actually slow down how fast your kidney disease progresses. And this has been shown in observational and interventional studies. So, what is metabolic acidosis? So, if you've ever heard of alkaline water, think of it as your blood becoming acidic. So, the opposite of alkali is acid, and instead of the water, it's we're talking about your blood. So, that's essentially what metabolic acidosis is. And your kidneys work to keep the pH, and that's what we're talking about here, in the normal range. So, if it's too high, it becomes alkaline. If it's too low, it becomes acidic. The kidneys in their normal healthy state work to keep the pH within a normal range. So if your pH is goes on the low side, and low is within the blood, we're talking changes at the 10th decimal point, 7.3, 7.2. These are small changes, but that's what we consider metabolic acidosis. That can promote the progression of kidney disease. And there's some nice papers and research done by Dr. Don Wesson on this issue. And what they've shown in interventional trials is that fruits and vegetables are just as good as nephrologists giving the sodium bicarbonate or some sort of prescription alkaline product, which is the standard of care. So if you have kidney disease and significant enough that you have metabolic acidosis, your doctor probably has prescribed you sodium bicarbonate or sodium citrate or Bicitra, one of these products to kind of neutralize the acid in your blood. Essentially, it's like the alkaline water that you might buy over at your grocery store, but it's a little bit more potent, and it's a little more concentrated. And what we've seen is that just eating fruits and vegetables does the same job in bringing that pH up and neutralizing the acid. The reason being is that in fruits and vegetables, there are natural alkali like citrate and malate and bicarbonate that are found in these foods that can neutralize the acid. And all it takes is 2 to 4 cups per day for most people. So that's another thing people can do to prevent progression of kidney disease. And even in amongst my house staff and the interns and residents and fellows that I see in my teaching, it's one of the things that we kind of overlook. It's just another number on the BMP that looks abnormal, and we kind of just gloss past it and kind of focus on the bigger things like
What number? You mean the bicarbonate?
the bicarbonate.
So what's a target for a bicarbonate that's healthy for the kidneys?
Yeah, so we aim for 22 to 24 to try and keep it there. But sometimes you may see people, with 16s or 18s or 20s, and a little bit of bicarbonate may help based on what we know from the literature.
And so 22 to 24, you don't want it higher than 24.
Right.
And so to be clear, if the bicarbonate level is lower, that means you have a lot of acid in the blood, and that means you're doing more damage day in and day out to the kidneys.
That's exactly right.
Now, can we also follow it with urine pH?
You that's a good question. I think you could. I've been using more of the serum bicarbonate to follow, but yeah, I guess you could.
Got it. So this is helpful. What other tests are useful? What about blood urea and nitrogen? I always thought that was a reflection on how much strain we're putting on the kidneys.
Yeah, so BUN is a byproduct of protein metabolism and nitrogen metabolism. And some people, so this kind of ties into with the metabolic acidosis, and then following this, we'll talk about phosphate levels. But for those who have kidney disease already, uh, it's been shown in a number of trials that limiting the amount of protein you eat can affect the progression of your kidney disease. And basically, what happens with eating too much protein if you have kidney disease is that your kidneys can sort of go into hyperdrive, and to try and keep up with all the metabolic needs of the body. So if you eat a lot of protein, your body has to digest that protein, and then there's a lot of byproducts, and those byproducts are things like nitrogen and blood urea nitrogen, which is measured, and those things need to be excreted out in the urine, or they'll accumulate, and then those things can cause problems. So what the body will do to kind of get rid of it is that after a high protein meal, is that the kidneys will go into overdrive to kind of get rid of this. For those who have kidney disease, going to overdrive is problematic because it's like having a car that isn't working so well, and you keep taking it onto the racetrack and just putting it literally pedal to the metal, and exerting it. So if you keep doing that, that's not ideal for a car that's already ailing. And similarly, for a kidney that's already ailing, putting it into this overdrive type state, that's the state's actually called hyperfiltration, uh, has been shown to lead to a faster decline in kidney function compared to those who eat a lower protein diet. So it's not to avoid protein altogether, because you still need protein for basic metabolism and for your muscles and for your body, but to avoid overdoing it. To not be getting all of your calories from protein sources. The amount is generally between zero point 0.6 to zero point 0.8 grams per kilogram per day of ideal body weight, certainly no more than 1.0 for most people. And definitely to avoid your so-called high protein diets, which are above 1.2 or 1.5 grams of protein per day. So that has been shown actually in a meta-analysis to have a small benefit in preventing the progression of kidney disease every year. The reason that this isn't widely adopted or widely dispersed even today is because it's kind of been overshadowed by the arrival of these medications, ACE inhibitors and angiotensin receptor blockers, uh, a decade or two ago. So around the time that this idea was becoming popular, it came to an abrupt halt with the arrival of these medications that basically did the same thing, and perhaps better. But it's still unclear whether the benefit would be additive if you combine both of these approaches, if you're in that position.
Both of
But
these
certainly,
approaches, you mean a low protein diet plus ACE inhibitors?
right, exactly.
Okay.
So, but it's not unreasonable to adopt this diet if you're on the medication, and there's good evidence to adopt a low protein diet even if you're not on the medication.
Okay. Now, of
Mhm.
course, another lab we have to follow is potassium, right? So everybody's afraid of getting too much potassium when you're eating all those fruits and vegetables.
Yeah, so potassium is a big issue. Uh, I'm actually working on a PowerPoint on potassium right now in plant-based diets. Historically, we've told patients to not eat high potassium containing foods, like fruits and vegetables. But what we've seen in the literature is that people who actually do eat these foods don't necessarily develop high potassium levels. And we think that's because of the relationship that the potassium in those foods has with the other component within those foods. So, for example, a potassium banana is also packaged with fiber. It's also packaged with natural alkali, and both of these things make kind of mitigate any rise in blood potassium levels. The fiber increases bowel movements, and the more bowel movements people have, the larger the volume, the more potassium people lose in bowel movements, which kind of balances out any rise in potassium. And then alkali kind of prevents the potassium levels in the blood from going up because it sequesters potassium within the cell. And then there's also recent literature coming out suggesting that the way potassium is packaged within plant foods because it's in a cell wall, it makes it harder for the body to digest and actually absorb, which is also interesting. So some people theorize that no more than half or two-thirds of potassium in plant foods is actually being absorbed, which is interesting. Um, Another micronutrient I want to talk about is phosphate levels, because it's kind of a similar issue, in that we used to think that plant foods were very high in phosphate, like beans and lentils and nuts. And we told our patients not to eat these foods because of how high the phosphate levels were in these foods. But what we've come to learn is that the bulk of the phosphate in these foods is actually bound to a anti-nutrient named phytate, and that prevents the phosphate in these foods from actually being absorbed when they're eaten, um, uh, uh, for the most part. In certain instances, if foods have been heavily processed or cooked under extreme temperatures or circumstances, that phytate molecule can become disrupted and cause the phosphate to be released, and then people can absorb the phosphate and then develop high phosphate levels. But your average home cooking of fruits and vegetables and beans and lentils, things like that, will likely not do that. And people can eat these foods without incurring an increase in phosphate levels for the most part. The reason I mention all this is because in some studies, they've shown that high phosphate levels has been associated with the progression of kidney disease. It's another point to think about in terms of progression of preventing the progression of kidney disease, along with metabolic acidosis, maybe phosphate levels too.
And plant-based diets are pretty much phosphate neutral, you think?
Phosphate neutral or low in phosphate. So the foods that are going to be high in phosphate. So if you think about it, are going to be your processed foods, your dark sodas. Problem is that although phosphorus is listed as an ingredient, it's not listed on the nutrition label in terms of its quantity. So it's hard for patients to, and even physicians to understand just exactly how much phosphate is in these foods. But in general, you're going to get more bioavailable phosphate in your processed foods because they're adding um, phosphate directly into the foods, and that's almost 100% bioavailable. And then your animal-based foods like meat and dairy are two-thirds bioavailable. I have two-thirds bioavailable phosphate. So of all the phosphate in those foods, about 66% of it is getting absorbed, and plants are anywhere between 10 to 40%. So that's why plants are more favorable in this regard.
Okay. So it looks like our checklist has taken a little bit of a direction in sort of the underlying cause. I'm gonna edit this after we conclude, but I think it's useful to know because when people think about eating a plant-based diet for chronic kidney disease, they're going to get a lot of people arguing with them. So it's
Yeah.
good to know that that it's actually not harmful to eat a plant-based diet. In fact, it is one of the best solutions we have to preventing the progression of kidney disease. Would you agree with that?
Yeah, and there's even some stories of people being able to reverse their kidney disease. That's not the majority. It's definitely the minority of cases, but it's definitely encouraging to see those kind of results.
It seems like kidney disease might be sort of reversible in the same way that dementia is reversible. That if it's early, if or to a small extent, you can sort of improve it, but you can certainly halt the progression of it with a switch to a healthier lifestyle overall. Is that
Yeah, right. Yeah, and we don't. The other exciting part about this is that we don't know the limits of what the body can do if given the circumstances. So that's kind of exciting to be at this point in science where we're now looking into this.
there's other elements of the standard American diet that it seems like there's so many elements of the standard American diet that are unfriendly to the kidneys. One of them would be TMAO. And we've seen some rather dramatic research around TMAO and its effects on progressing both congestive heart failure and chronic kidney disease. Any tips regarding TMAO? Does that belong on our checklist in any way?
Yeah, so TMAO you find in your red meat and some seafood, and that the TMAO levels. TMAO is this compound that has been associated with uh, uh, adverse cardiovascular events like heart attacks and strokes and death. And as kidney function declines, this compound increases, and it's thought to actually further contribute to worsening kidney function. And this all ties into the microbiome and how the microbiome works with diet, um, and how that affects ultimately your health. So this is an active area of research. And needless to say, the foods that contribute to TMAO haven't been uh, foods that were healthy to begin with for your kidneys. These are foods that tend to be high in acid. They raise blood pressure. They tend to have a higher bioavailability of phosphorus. So it's just another strike against them for people with kidney disease. And like you mentioned, eggs, red meat, certain seafoods that contribute to the production of TMAO in our microbiome.
And the microbiome, is that something that there's a direct link, or is it just sort of more of an association between a quote unquote, healthier microbiome and healthy kidneys?
Yeah, that's an area of active research. It's more associative at this point. We haven't um, we don't have something to hang our hat on at the moment. It's actually something that I'm actively researching in right now, or trying to. But maybe in the coming years we'll have some more information.
How about hydration? Is there any evidence that staying adequately hydrated, drinking a lot of people I find really are dehydrated much of the day and drinking very little water. And when people do that, their blood urea nitrogen levels can go up. So I'm wondering if there's any evidence that staying hydrated preserves the kidneys.
Yeah, so hydration is important, especially if you're someone that is on a number of medications. You definitely don't want to be dehydrated. And then especially if you have kidney stones, I tell my patients with kidney stones to try and keep their urine clear to light yellow. So if you're someone that has consistently very dark orange or red urine, it might be helpful to drink a little bit more water. But those with kidney disease can get in trouble by drinking too much water, because then you might exceed the ability of the kidney to get rid of that water, and then that can contribute to swelling, edema, high blood pressure. So it's definitely a fine balance, and it depends on the individual situation and the stage of kidney function and the other health problems that you may have.
Okay. So a good amount of water as a rule of thumb. What about 2 liters a day? Or I guess that would be too much.
There's no great evidence on how much it is, and that's because it varies individual needs. If you're up here in the north and the air is dry, you may find yourself being thirsty. If you're in a hot, humid climate, you might find yourself sweating, so you might need a little bit more. It depends on the size of the person, things like that, how much you exercise, how much water you're getting from your foods. People who eat more plant foods tend to have more water in those foods. But something to avoid is the drug class of NSAIDs, especially if you have kidney disease,
Yes.
because NSAIDs affect blood flow to the kidney and then can contribute to kidney injury, especially if taken at high doses, especially if combined with ACE inhibitors or angiotensin receptor blockers. So those medications, if you're taking them, consider maybe switching to Tylenol, or taking them with a glass of water, or taking the lowest dose that you possibly can. to avoid injury to your kidneys.
That's a vital one. There's some other medicines that linked with kidney failure. How about the proton pump inhibitors?
Yeah, so that kind of touches back on some people having allergies to having a kind of an allergic reaction in their kidneys to medications. And there's a list of medications. Some NSAIDs fall into that class. Proton pump inhibitors fall in there. Antibiotics fall in there. Almost any medication can give you an allergic reaction, and that can affect the kidney. So this is kind of why it's important to see a kidney doctor if you have kidney dysfunction, and then to even consider doing a kidney biopsy, because the really only way to find out if you have an allergic reaction to a medication within the kidney is to do a kidney biopsy.
So you raise a good point that you should see a kidney doctor. What would be the trigger that you would recommend to warrant sending somebody to you?
Yeah, some people have hard and fast rules to send um, based on the stage of kidney function, but it depends on the patient, it depends on the physician and the situation. I have people with stage 1 or 2 kidney function, and we spend a lot of our time just talking about the things that we talked about today. And I would like to think that our interactions are worthwhile, and that me talking to my early stage kidney patients prevents their progression, prevents them from being on dialysis, and they may not have gotten that information earlier on. And then, obviously, if you have significant kidney dysfunction, stage, 5, stage 4, and even to the extent of stage 3, not unreasonable to see a physician, a kidney doctor. Um, especially people should see a kidney doctor, especially if the trajectory of the kidney dysfunction is significant. So if you have stage 3 kidney disease and you're stable and your primary care doctor is doing a great job, you may not need to necessarily see a kidney doctor. But if you went from stage nothing to stage 3 within 6 months, then something may be going on, and that may be worth seeing a kidney doctor.
Well, I would say people with stage 0 kidney disease should see Dr. Shivam Joshi, because this guy has a couple tricks up his sleeve that most doctors don't have. And he's got a few slide decks that speak to a very thorough understanding of the literature around how to keep these kidneys healthy, but also how to keep you alive for as long as possible.
That's
So
very nice of you to say. Yeah, I try to keep a couple tricks up there, but hopefully I'll have a few more as time goes on.
I like to think of us doctors as general contractors with a toolbox, and it's a question of what tools are in our toolbox. And I think if you're just going by what you were trained in medical school, your tools in the toolbox often are mostly just medications, um, depending on the subspecialty. But it is nice. That's one of the nice things about lifestyle medicine is you fill up your toolbox with a whole lot of other very handy tools.
Yeah, exactly. Medicine is a career of lifelong learning, so you're constantly adding tools to the toolbox.
Well, that as well. That curiosity, that lifelong curiosity. What we don't want to do is kind of close the door on our education after we finish medical school, or we will, propagate the old style of thinking for the whole rest of our career.
Right, and that's why we have blogs or websites like yours, healthrules.org, to keep people educated and informed.
So, just to finish up, is there anything else you can think of, Dr. Joshi, that would help somebody with chronic kidney disease to preserve that kidney function? Something that sometimes gets missed. So the NSAID, oops, we forgot to stop the NSAID. That daily aspirin, or the proton pump inhibitor, perhaps. Any other strategies or ideas?
Uh, in the time of COVID, I would say just to stay connected with your doctor, to to get, follow up with getting your labs done, make your appointments, don't be a no-show, be compliant with the medications. If you run out, get your refills. Especially in time of COVID, it's becoming a little bit harder for physicians and patients to stay connected, but whatever patients can do to stay on top of their health, that certainly will facilitate the care of their health.
Hmm. It's an important point. And I think when you look at the percentage of people who actually take the medicines that have been prescribed for them, it tends to be very low. So, so this is a case, chronic kidney disease, and a number of other conditions in medicine where you really do want to be faithful with your medicines and stay close with your doctor. And
Right.
you're right about
Exactly.
COVID. That's that's the issue of the day. As we record this, we're going through an explosion in the number of cases and the severity of the cases. So it is a little bit of a scary time.
Yeah, exactly.
So, Dr. Joshi, I am going to conclude there and let you get back to your life. So, I want to extend my words of gratitude to you for taking your time on a Saturday morning to talk about this stuff and for all the work you're doing communicating this. I've been watching your videos online and following you on Twitter, which that handle one more time is
S. Joshi, MD.
S Joshi MD. On Twitter, and it's good stuff. It's really powerful, and I'm just excited that you are helping to create more voices like your own, in not only the kidney community, but more broadly in lifestyle medicine, internal medicine, and beyond. So many thanks for the great work you are doing.
Oh, no problem. Thanks for having me. It was a pleasure. And it's work like yours that keep the message going, because after my talk ends, or after people get done with reading my paper, it's on to the next thing. So the work of you, the work that you
Well,
do and other people do, kind of keep the message going out
many
there.
thanks. We're going to try to package this into something that's going to be usable on an ongoing basis. It has some persistent value. It's something that people can refer to over and over to try to keep those kidneys healthy. Because kidney health, like brain health and heart health, it's not something you check a box and you're done. You have to live the life every single day. So many thanks for helping me craft that checklist today.
No problem. Anytime.
I will
Yeah.
wish you all the best, Dr. Joshi, until the next time we cross paths.
Sounds good. Thank you, Dr. Donahue.
Take care. Bye now.
Bye bye.